Do you ever get a strange tingling in your feet? Or notice your heels feel drier than usual no matter how much lotion you use? Most people ignore these small changes, but doctors warn that your feet can actually be early warning detectors for something much bigger. Today, I'm going to show you 9 warning signs in your feet that could mean diabetes, and the reason you cannot afford to ignore them. Welcome back to HEH. I'm Dr. Vivian Hart. Your feet are incredibly sensitive indicators of your overall health. They have the longest nerves and the smallest blood vessels in your body. That makes them the first place where damage from chronically high blood sugar often appears. In fact, research suggests that foot complications are among the earliest detectable signs of type 2 diabetes, sometimes appearing years before a formal diagnosis. A 2023 study published in the Journal of Clinical Medicine found that nearly 20% of patients diagnosed with type 2 diabetes already had some form of diabetic neuropathy at the time of diagnosis. That means nerve damage had been happening silently for years. So what are the specific signs? Let me walk you through them one by one. Sign number 1. Tingling, numbness, or a pins and needles sensation. This is the most common early sign of diabetic peripheral neuropathy. High blood sugar damages the myelin sheath, which is the protective coating around your nerves. Think of it like an electrical wire with frayed insulation. The signals get crossed, and you feel strange sensations. Some people describe it as walking on cotton or wearing an invisible sock. Sign number 2. Burning pain in your feet, especially at night. This sensation often starts in the toes and slowly moves up. It can range from mild discomfort to severe pain that interferes with sleep. A 2021 study in diabetes care observed that over 50% of people with diabetic neuropathy reported that their symptoms were worse in the evening. The reason may be related to how blood flow and nerve activity change when you lie down. Sign number 3. Extreme sensitivity to touch. Some people find that even the light pressure of bed sheets feels painful. This condition, called allodynia, happens because damaged nerves send exaggerated pain signals to your brain. What should feel like a gentle touch is interpreted as burning or stabbing. Sign number 4. Loss of balance or coordination. Your feet send constant feedback to your brain about where your body is in space. This is called proprioception. When nerves in your feet are damaged, that feedback becomes unreliable. You may feel unsteady on your feet, especially in the dark or on uneven ground. A 2022 systematic review in the Journal of Diabetes Research found that people with diabetic neuropathy are 2 to 3 times more likely to fall compared to those without nerve damage. Sign number 5. Changes in foot shape. High blood sugar can damage the tendons and ligaments in your feet over time. One common deformity is hammertoe, where the middle joint of a toe bends downward. Another is Charcot foot, a serious condition where the bones in the foot weaken and collapse, causing the arch to drop and the foot to become rocker bottom shaped. These changes are not just cosmetic, they create pressure points that can lead to ulcers. Sign number 6. Dry, cracked skin, especially on the heels. High blood sugar can affect your sweat glands. When they don't work properly, your feet lose natural moisture. The skin becomes dry and thick, and cracks can form. These cracks are dangerous because they create an entry point for bacteria. A small crack can quickly become an infected ulcer, especially in someone with poor circulation. Sign number 7. Slow healing sores, cuts, or blisters. If you have a small cut that takes weeks to heal, that is a major red flag. High blood sugar impairs your body's ability to repair tissue and fight infection. It also reduces blood flow to the extremities. A 2024 study in the New England Journal of Medicine found that delayed wound healing in the feet is one of the strongest predictors of future amputation risk in people with diabetes. Sign number 8. Cold feet or changes in skin color. Poor circulation, medically called peripheral artery disease, often accompanies diabetes. You may notice that one foot feels colder than the other. Or your feet may look pale, bluish, or reddish-purple. This happens because narrowed blood vessels cannot deliver enough oxygen-rich blood to the tissues. A 2025 study in Circulation observed that people with diabetes are 4 times more likely to develop peripheral artery disease compared to people without diabetes. Sign number 9. Thickened, discolored, or ingrown toenails. Fungal infections are more common in people with diabetes because high blood sugar feeds the fungus. You may notice your toenails turning yellow or brown, becoming thick and brittle, or separating from the nail bed. Ingrown toenails are also more common and can easily become infected. Never try to cut out an ingrown nail yourself if you have diabetes. See a podiatrist. Now, here is the important follow-up. Seeing one of these signs does not mean you have diabetes. Many conditions can cause these symptoms, including vitamin deficiencies, thyroid disorders, and nerve compression. But these signs are your body's way of sending a message. And you should listen to it. So what should you actually do if you notice any of these warning signs? Let me give you 3 actionable steps. Step 1. Schedule an appointment with your primary care provider. Ask for a fasting blood glucose test and an A1C test. The A1C measures your average blood sugar over the past 3 months. An A1C below 5.7% is considered normal. Between 5.7 and 6.4% indicates prediabetes, and 6.5% or higher suggests diabetes. These tests are simple, inexpensive, and could save your feet. Step 2. Start a daily foot inspection routine. Check your feet every single day. Look at the tops, bottoms, and between your toes. Use a mirror if you cannot see the soles of your feet. Look for cuts, blisters, redness, swelling, or any changes in skin color or temperature. If you find something, do not try to treat it yourself. Contact a healthcare provider. Step 3. Adopt preventive foot care habits. Wash your feet daily with warm, not hot, water. Dry them carefully, especially between the toes. Moisturize the tops and bottoms, but not between the toes, because excess moisture there can lead to fungal infections. Trim your toenails straight across. Never cut into the corners. Wear properly fitting shoes that do not rub or pinch. And never walk barefoot, even indoors. A small step on a sharp object can lead to a serious infection. Let me also tell you what not to do. Do not use heating pads or hot water bottles on your feet. Nerve damage can prevent you from feeling burns. Do not soak your feet in Epsom salts or harsh chemicals that can dry out your skin and increase cracking risk. Do not use over-the-counter corn removers or sharp instruments on calluses. These can cause chemical burns or accidental cuts. And do not ignore a small problem hoping it will go away. In diabetic feet, small problems become big problems quickly. Now, if you already have diabetes, these warning signs are even more critical. According to the International Diabetes Federation, 1 in 5 people with diabetes who enter a hospital do so for foot-related problems. And foot ulcers precede approximately 85% of diabetes-related amputations. That sounds frightening, but here is the hopeful part. Up to 80% of those amputations are preventable with proper foot care and early intervention. A 2025 study in the Lancet Diabetes and Endocrinology examined the impact of structured foot care education. Patients who received regular foot exams and preventive education had a 60% lower risk of developing foot ulcers compared to those who did not. This is not complicated, it is consistent. Let me also address a common myth. Some people believe that if their feet do not hurt, there is no problem. That is dangerous. Diabetic neuropathy often causes loss of sensation, not pain. You can have a serious infection or a deep ulcer and feel nothing. That is why daily visual inspection is so important. Pain is not a reliable warning sign when nerves are damaged. Another myth is that soaking feet in warm water is good for them. In fact, prolonged soaking can strip natural oils, causing dryness and cracking. A quick wash is sufficient. If your feet are dry, use a moisturizer designed for diabetic skin, which is usually free of irritants and alcohol. I also want to talk about shoes. Ill-fitting shoes are one of the leading causes of foot ulcers. A 2022 study in the Journal of Foot and Ankle Research found that nearly 70% of people with diabetes wore shoes that were the wrong size. Your feet can change shape over time due to neuropathy or previous swelling. Have your feet measured professionally every time you buy new shoes. Look for shoes with a wide toe box, soft leather or mesh upper, and a cushioned sole. Avoid pointed toes, high heels, and shoes with seams inside that can rub. Now, when should you see a specialist? If your primary care provider diagnoses diabetes or prediabetes, ask for a referral to a podiatrist. A podiatrist can perform a comprehensive foot exam, including monofilament testing, which checks for loss of protective sensation. They can also trim your toenails safely if you have difficulty, prescribe custom orthotics, and treat any existing problems before they become serious. What about warning signs that need immediate medical attention? If you notice any of the following, go to an emergency room or call for help right away. A foot that suddenly becomes red, hot, and swollen. Black or dead tissue on any part of your foot. A wound that is draining pus or has a foul odor, uncontrollable pain, fever along with a foot problem. These are signs of a severe infection or gangrene that can spread quickly. Remember, this is educational content. Always consult your healthcare provider before making significant changes to your health routine, especially if you have a known medical condition or take prescription medications. Do not use this information to diagnose yourself. See a doctor. If you found this video helpful, share it with someone who needs to hear it. Foot health is often overlooked, but these 9 warning signs could save someone from a serious complication. Subscribe to HEH for more science-based health education. I post new videos every week breaking down complex health topics into simple, actionable steps. And leave a comment below. Which of these 9 warning signs surprised you the most? I read every single comment, and I will do my best to answer your questions. I'm Dr. Vivian Hart. Take care of your feet, and I will see you in the next video.